All right, time to feel better with Dr. T. And if your back is aching, and whose back doesn't ache from time to time, right? You can actually get a lot of relief with something called decompression. And Dr. T is here from the North Tampa Spine and Joint Center with more information on this. All right, what is decompression?
What is decompression? Decompression is as simple as taking the two vertebrae in your spine and gently pulling them apart to some degree. Not in a bad fashion, but what it does is when you pull apart, it creates a negative force pulling in the disc, which can help retract it if it's putting pressure on the nerve, or your symptoms could be caused from that disc herniation. So a retraction of that disc, right, pull it back in. Secondary is it can help pull and suck cells, fluid, nutrients, which can speed up the healing process, which could be the result of your pain as well.
How is that pulling done?
Pulling is, there's various machines. There's a array of them, okay? So it doesn't really matter. It just depends on the machine.
Okay.
But remember, it's sucking the nutrients. Think of garbage in, groceries out, right? Keep that process going.
Right.
If you're a surgical candidate, so you have a disc bulge and you're a discectomy patient, if you have the disc putting pressure on the nerve, go get decompression therapy first. At least go through a cycle of that. Seek your physician, see which route would be better for you.
It's considered a conservative treatment as opposed to obviously going in and getting some invasive back surgery.
Right, do conservative before invasive every day of the week.
Always.
If conservative fails, then push on to the next levels, maybe start injections, then seek surgery last resort. Don't just go to surgery just because someone said you should.
Right.
Do conservative first, and decompression is a big one to help kind of alleviate a lot of your back symptoms, depending on what the problem actually is.
Okay, Dr. T, always a pleasure. And for more information on decompression or anything else we just covered, go to mydrT.us. And we'll see you Tuesdays and Thursdays as always.
Yeah, man.